Good afternoon.
Deepak sir.
Good afternoon. Indian Society for Veterinary Surgery welcome today's speaker, Dr. Bhupen Sharma sir, and all the participants to this webinar. Briefly, I would like to introduce Dr. Bhupen Sharma. Dr. Bhupen Sharma is working as a professor in the Department of Veterinary Surgery and Radiology, College of Veterinary Science, Assam Agriculture University, Khanapara campus, Guwahati. He is graduate and postgraduate in veterinary surgery with distinction from the same university. Then he did doctorate of philosophy in veterinary surgery and radiology with specialization in anesthesia from G.D. Pant University of Agriculture and Technology, Pantnagar, with highest OGPA. He is recipient of CSIR and ICR fellowship. Dr. Sharma has published 81 research papers in different international and national journals. He also published a book on wildlife and more than 50 popular articles in Assamese language. Till date, he has guided 12 MBSc and 3 PhD students as major advisors and acted as advisory committee member of many postgraduate students. He is principal investigator of a collaborating research project with IIT Guwahati and Medical College Shillong. He also acted as a referee for many international and national journals. Dr. Sarma has notable contribution in wildlife anesthesia and surgery. He standardized the dose of medetomidine anesthesia in elephants as a global record and published research in Veterinary Science, London, and incorporated in Lum and Jones Veterinary Anesthesia published from USA, and in Biology and Wildlife Medicine by Mikota and Polar, USA. He has presented research paper on etipamazole as a reversal of medetomidine in elephants in the International Elephant Research Symposium held at Texas, USA in 2004. He presented a paper on critical care of elephant calf in International Conference at Denmark in 2006. He also standardized the dose of medetomidine in rhinos and presented in the International Rhino Research Symposium, which was held at Netherlands in 2011. Dr. Sarma carried out the pioneer work of rhinos translocation from Kaziranga to Manas National Park, Assam, under special observation of Wildlife Trust of India and IFAW USA and Government of Assam. Beyond these, he worked as a resource person to Wildlife Institute of India, Dehradun, Wildlife Trust of India, Forest Department of Assam, IIT Guwahati, and various veterinary colleges of India. Popular scientific talk delivered by Dr. Sharma has enriched SSB, NCC, NDRF, and also the school students of the rural Assam. He is a renowned wildlife surgeon, extending his services in the states of north-eastern areas of India and operated elephant, rhino, tiger, bear, deer, and many other endangered species. He is a popular canine surgeon in the northeast regions of India and rendering his services to Air Force, Army, SSB, CISF, Assam Police beyond servicing the pets to common people. He also operated the dogs of Bharat Ratna awardee Bhupen Hazarika, Air Marshal Hari Kumar, Lieutenant General of Army, MC Ved, etc. Dr. Sharma is a life member of Indian Society for Veterinary Surgery, Blue Cross Society, Assam, and the Small Animal Practitioners Association of Assam. Looking to his considerable experience in the field of wildlife surgery and anesthesia, I request Dr. Sharma to deliver the webinar on today's topic, wildlife immobilization and anesthesia field experience. Dr. Sharma, please.
सर अनम्यूट कर लीजिएगा.
Good afternoon to everybody. Respected members of the Indian Society for Veterinary Surgery and my friends. Today I have been interested to deliver a webinar on the topic wildlife immobilization and anesthesia for field experience. Wildlife anesthesia is a challenging and adventurous work. It was very difficult till 1962, but following the discovery of xylazine by the company from Germany, it paved the way of restraining wild animal. In the recent years, many of the new anesthetics with wide margin of safety and higher potency has come to the market, which can restrain the animal from the smaller to the biggest, even it is including from the small albino mice to the mammoth elephant. So with this things, we can cover a lot many animals where the surgeon can anesthetize all species of animal as per his requirement, and the duration can be made accordingly. Following performing the operation, they can anesthetize, the anesthetized animal can be returned with the help of reversal to the normal. Even the newer anesthetics are very fine, and that can be used in the pregnant and clinically compromised animal. Now, about this newer anesthetics groups, if you have a look, then you will find adrenoceptor agonist, alpha to adrenoceptor agonist group, and there out of this medetomidine is the king of all. That is the 30 times more powerful than xylazine and more refined. Because of its excellent property, it can be used for all of animal with different doses. And secondly, if you are coming to this ditomidine, which is 20 times more potent than xylazine, can be used specially for equine. Also, at the same time, the all wild animal like the zebra, giraffe can be nicely anesthetized with that particular drug. Following that, this romifidine is another anesthetic which is targeted for the equine as well as the ruminant. All large animal can be nicely tamed with this. In addition to that, this dissociative anesthesia, ketamine plays a pivotal role because ketamine can be act as a sole anesthetic for many of the species like feline, also for some of the very notable endangered species. Beyond that, ketamine is added with the alpha to adrenoceptor agonist, where it is acting as to help as a balance anesthesia, and most of the operations of any duration can be covered by this, and successful operation can be carried out. Tyletamine is another member which is not used alone because of this converging properties, that is added with the zolazepam and marketed under the brand name of Zolatil or Telazol. Now the third group, the tranquilizer, azaperon, aceclomazine and diazepam. Among this, azaperon is one of the excellent tranquilizer having special affinity for this swine species. Moreover, the azaperon is used as an adjunct of the balance anesthesia in wild animal at different doses. The specific character of this azaperon is that it prevents this bradycardia and respiratory depression. Moreover, it maintain a good oxygen saturation. That is why nowadays it is getting priority in the wildlife medicine. Now, among the narcotics, ethorphine is the most powerful, where hardly 1 milligram per 1000 kg body weight. That means for a bigger elephant of 4000 kg, 4 and 5 milligram is enough to sedate it. But the problem is that this anesthetic is causing profound respiratory depression, and many a time respiratory failure has developed and death. African workers from their jungle has reported that 7% death is possible with ethorphine. But in India, the condition is such that we cannot even think for a single person death. That is why the anesthetic world is now cornering the ethorphine and trying to use with a successful another group of anesthetics. Another number is the butorphanol, which is a antagonist opioid, and that is used at a lower percent in adjunct of this medetomidine and ketamine anesthesia, which is providing a cardiovascular stability and good analgesia for giving a very successful step in the anesthesia. Then the neuroleptic anesthesia. You are knowing all about this immobilon, LA and inovarvate, but in the recent years, most important has given by the wildlife workers regarding this balm. The balm is a combination of butorphanol, azaperon and medetomidine, which is one of the excellent anesthetics, and you can say straightly that this casualty is never happening with this group. That is why almost all workers having the knowledge of the anesthesia are preferring balm to use in their recent years. Some of the photograph of the substances I am showing here as alpha 2 adrenoceptor agonist. Number one is the domoscidine, that means ditomidine, then meditomidine, then romifidine under the brand name of Serifed. Then this is the reversal etipamazole, then LVGesic, that is butyrophenol, then stresnil, that is your butyrophenol derivative, and then zoletil. So these are the commonly used anesthetics, and very dreaded anesthetic of this opioid group is ethorphine. The most powerful, when you are going to do it, very certainly it will capture the animal any range. It may be rhino, elephant within a very short time. But the problem is that here the danger point is associated with the handlers. That is why a assistant is always loading the drug of this diphenhydramine, which is reversal. But considering these all things, considering the danger point, profound depression of the respiratory system, ethorphine use is being limited nowadays in the anesthetic world for the wildlife. Meditomidine sedation in elephant has been tried in not many animals, and with successful results we are noting the record. This meditomidine at the dose rate of 5 microgram per kg body weight. You are knowing already, and you will be happy to know that is standardized by me here by working in the jungles of Assam with the elephant, and which was published in the Research in Veterinary Science from London, and a part of which I have presented in International Elephant Foundation Symposium in Texas, USA. That is incorporated in the Lam & Jones anesthesia, also in the anesthesia book and biology and wildlife medicine by Fowler and Mikota from USA. So while you use meditomidine at the rate of 5 microgram per kg body weight for a biggest size elephant, it is coming hardly 15 to 20 milligram. After getting injection of these things within 5 minutes, the animal will be sedated, and the peak sedation will be received by 15 minutes. While you compare with the xylazine, then the deep sedation is getting only in the 30 to 45 minutes. So, considering these things, the meditomidine is giving a good sedation and of good duration of 2 hours, and all the parameters are almost near the normal. Little depression in the cardiac system is that is mitigated by adding other substances like azaparan, or by adding ketamine, or by adding butyrophenol. So while you tranquilize or sedate an animal with the help of meditomidine, what symptoms you will observe? The animal, just after sedation, you will observe that there is a relaxation of the trunk. The trunk will be touching ground, and then the animal showing the widening of the leg. The weight will be dispersed, and you will observe a deep snoring sound, which is audible even for 200-300 meters away. Once it is coming to this stage, you can say the animal is nicely sedated. And the first and foremost thing is that this special anesthesia even can be used for clinically compromised and pregnant animal. Now see, I am showing some example of this clinically compromised animal. See, in the left side, this elephant is a very old geriatric patient having a problem in the leg where it was performed surgery, keeping the animal in standing sedation. Now see that if you use xylazine or other anesthetics for that animal, certainly there will be bradycardia and death. So with meditomidine, you can successfully completed, successfully completed the operation in a rural area. The right one is a wild elephant. It was getting train accident, and it was a female pregnant animal, and there, because of the train accident, there is continuous flow of blood from the uterus, vagina. So we have sedated in standing and given sufficient volume of fluids just to maintain the blood volume. And also the life support was given to this animal so that we can make it alive. See, that is another history in treatment of the wildlife. Here the elephant tusker that was getting a femoral fracture problems. So when the owner has approached all the experts from our country as well as from USA. All have suggested euthanasia. But while this man has come to me, I have told that euthanasia is the last resort. First, we have to go for the treatment. So immediately, I accompanied that person, went to the forest near the jungle area, and I sedated the animal in standing, get the measurement of the fractured leg, and tell him, drawing a diagram to make a splint from iron fabrication. So after preparation of these things, it was fitted to the leg with the help of nut and bolt showing in the next photograph. So that was maintained for 60 days. And after 45 days, the animal has started walking, and ultimately it has come to the normal. And after 3 months, it has shown the total normalcy, which is considered to be a record in healing of the fractured bone in elephant. Now see, these are some other ways by which we are using in elephant for as a splint, and most of these works have to be carried out in the standing, either on meditomidine or in romifidine sedation. Now see, not only for the elephant, this meditomidine is such a good drug, can be used for the tiger. I have operated numbers of tiger in the northeast, not only in Assam, also in the neighboring states, where we are using 50 milligram per kg, and in addition to that 2 milligram per kg ketamine. When you are darting these things, within 2 to 3 minutes, the tiger will lie down, and within 10 minutes you will get deep anesthesia when you can start your surgery, and you will get 2 to 3 hours duration with excellent muscle relaxation, and by this time you can perform the operations. Following completion of the operation, you can reverse it by injecting etipamazole, and it takes approximately 7 minutes to come to the normal. See, that is a tiger where this tiger was suffering from a cat elbow in that leg, showing the swelling of the leg, where you can observe this how big swelling it is. So that was targeted under this, and see, this is during the operation. I have removed this big swelling just like a football, and during this operation now you will be able to understand how big it is. So following completion of the operation, this area is covered with the plaster of Paris and kept inside the cage for 15 days. Then when plaster was removed, it has come to the total normal. So that means the meditomidine ketamine is providing a good relaxation and analgesia to perform operations. And you will be surprised that is reversed with the injection of etipamazole. But one thing has to be remembered, that while you are going to reverse it, the animal should be put immediately inside this cage, so that it cannot come back, it cannot recover, it cannot attack you, because you will get maximally 7 minutes. By this time, just after injection of this etipamazole, you have to come out and lock the cage so that the animal cannot attack yourself. So that is point. Another point where a tiger was operated in my neighboring state Tripura. The tiger was suffering from uterine problem. A team from IVRI and Wildlife Institute of India has visited this site, and they have rightly diagnosed that it is a uterine problem, but they declined to perform operation because of the poor condition of the animal, and telling that it is an anesthetic risk. When they have invited me for that, then I have taken the responsibility of this, and I sedated the tiger by giving the 50 milligram meditomidine per kg and ketamine 1 milligram, and then the animal was anesthetized, and I performed the flank operation, the panhysterectomy operation in Tripura Zoo. Now see that after that I have removed this uterus, where the uterus is showing a big cyst in the ovary and a uterine fibroid. Probably because of continuous use of antibiotic, there was not much pyometra or pus in the uterus. Then that was removed, and it took 1 hour 23 minutes to perform the operation under this combination. And following completion of this operation, I put the animal on the squeeze cage and reverse it. See, squeeze cage is very helpful for the veterinarian wildlife veterinarian particularly, because the wild animal after putting in the squeeze cage, you need not go for repeated sedation for giving antibiotic and other supportive drug for the post-operative period. Suppose generally we are maintaining for 7 to 9 days post-operatively, and at that time we are keeping in the squeezing the animal there, and from outside you can inject all this. The animal cannot do anything because it cannot move when you squeeze properly. So after completion of our work, we are again relaxing it so that it is like a cage, and likewise it is giving a comfort for the veterinarian for the treatment of the animal. Now, injured leopard, it is a common problem in our place in Guwahati and in neighboring area and in different parts of the Assam, because it is covered by the tea garden, and most of the area are having many numbers of this leopard, and they are coming to these villages, and there is a fighting with these people and the animal, and many a time they are killing the either human being or the man are injuring this. That is one of the example of that, where it was injured, and we anesthetize the animal by giving this xylazine and ketamine 100+100 both, and we have performed this operation. Injury get in the mouth. So meditomidine sedation in rhino is one of the excellent things here, because if you use xylazine and other things, even in several ml or even 100 ml or more, then even after that it will be very difficult to sedate a rhino. Common anesthetics are not able to sedate it because of its inherent power. Only the earlier it was used the etorphine, and I am telling many a time etorphine is killing the rhino. So nowadays choice has come to the meditomidine, and that is used for 20 microgram per kg body weight. That is also standardized by me here, which I have presented in the International Rhino Symposium in Netherlands, and it is accepted by the international community. So when you will do with that, you will get induction of the animal within 5 minutes, and it will come to the requirements in 7 minutes, and you will get duration of 1 to 2 hours. But the thing is that if you do with the only with meditomidine and ketamine, then there will be decreased heart rate, that means bradycardia and respiratory depression. But still it is in the good side. Anesthesia is good, relaxation is good. You can perform any operation under this. See, that is a rhino. We are generally going for radio collaring. You will be able to see that is a radio collar fitted to the animal under this meditomidine ketamine, where I have assessed the heartbeat during that. And we found that the heartbeat by using the meditomidine and ketamine from the 60-62, it is coming to 48. That means it is one kind of bradycardia it has developed. So we have to support it with that. But in comparison to that, when we are using the ditomidine, butyrophenol and azaparon anesthesia in rhino, ditomidine 30 mg, butyrophenol 10 and azaparon 40. That means ditomidine 3 ml, butyrophenol 1 ml and azaparon 1 ml. That means total 5 ml. It is very comfortable to take load in a 5 ml dart, and it can be darted from far away, more than 200 meters away. And the rhino will be sedated nicely, where complete relaxation you will find. You can carry out any operation. But most notable point here is there is no bradycardia. In that animal, from 60 to hardly it is coming to 58 or 59. That is almost remaining static. It is because of the azaparon which has resisted the depression of this heartbeat as well as the respiration. Moreover, when we have assessed this oxygen saturation SpO2, it was above 90. See how we are adding this with the help of this machine, SpO2 machine, pulse oximeter. We have fitted it to this gum or tongue of this animal, and it is showing this SpO2 level above 90, and that indicate that this anesthetic combination is giving excellent. And we are performing here radio collaring, then air taking. You see, air taking is a functioning, the air is a very painful, very sensitive. But even after doing this such cases with under this combination, the animal is not feeling pain. After completion of this operation we have reversed it by our normal this antipomonal substance. Anesthesia of the black bear. So that bears are very common in the northeastern states. Even in the Pake is a national park in Arunachal Pradesh, where numbers of bears are there. One of the bear was taken to the college for treatment, which was not able to walk. So we have sedated by giving 30 microgram meditomidine and 2 milligram ketamine, which was induced very quickly. And then we got X-ray. We find out it was suffering from the femur fracture, and that was the bear, and which we have performed for operation for giving pinning. The intramedullary pinning was performed in that bear, and we maintained the animal inside the cage for 45 days. After 45 days, the bear was shifted to this national park in a big enclosure, and our workers, wildlife workers, has observed, and after 60 days, it has started climbing on the trees. That is generally observed by the IFO, International Fund for Animal Welfare, from USA and Russia. The most expert from the Moscow has visited, and they have advised to release this animal in the wild. So it was again released, sent back to the jungle. The swamp deer translocation, that was another problem of Indian people, because swamp deer is a very important species because it is a main prey of the tiger. If swamp deer is remaining in a jungle, then the tiger will get their prey and they will be alive. So for tiger conservation, swamp deer should be maintained in that forest. So looking to this importance of this condition, the people from Kashmir, people from Bhopal, and people from Bengal, wildlife people have tried to give anesthetic management of the swamp deer, but all has failed. Then an expert was called from Africa, Dr. Marcos, with whom our state government personnel, forest officials, and we from College of Veterinary Science have sit together, and ultimately I lead a team initially to carry out the work with meditomidine 100 microgram per kg and ketamine 1 milligram per kg. We have anesthetize the animal in Kaziranga. You will be happy to see this, how we are going in the elephant back inside Kaziranga jungle, and then we are finding the flock of the deer. See inside Kaziranga, that is a deer flock, swamp deer flock. From elephant back, we have darted this one of this animal, and it is lying down. Then immediately this elephants are guarding us so that the other animal, wild animal, cannot come to attack us. Then immediately we are going down, we have assessed this heartbeat, we have assessed the temperature, because these two things are very important. Heartbeat, if there is very severe bradycardia, then we have to give support with this dexamethasone or by atropine sulfate. And the most important thing is temperature, shooting of the temperature. Majority of the cases, there is shooting of the temperature up to the 41 degrees centigrade, and it is dying. So that is why we are keeping here. Probably you are able to see here, we are keeping a oxygen cylinder to give oxygen support. But in our case, when we have performed with the meditomidine and ketamine, we have successfully overcome this program, and we have fitted radio collar to the animal, and we have assessed the heart. It is almost in the stable state, and after that we have reversed the animal to go back to this original flock. So we send this message to the government that we are successful. Now one can follow, the other state can also follow. See, that is a radio collar for the large animal, where it is fitted to the large animal like the rhino, even the elephant and other big animals. But for small animal it is different. And this is a signal system. After fitting of the radio collars, the animal will go far away from, and you can, by sitting in your laboratory with these signals, you can detect whether the animal is alive, it is grazing, or it is killed by the posters. Now see, after reversal, after giving the reversal injections, our animal which is captured by this meditomidine ketamine, after radio collaring, it is going again into the jungle. Now see, spaying of the monkey is another problem, where ketamine can be used as a sole anesthetic at the dose rate of 15 milligram per kg body weight. You know, generally the Hindu temples in the India are almost dominated by the monkeys, and they are attacking the pilgrims or the devotees coming to the temple. So that has happened in Assam also. So as a measure, government of India has taken a program to Spain, and in one of the program we have started this pain. Now this pain technique, after anesthetizing with the help of this ketamine, this pain technique is something different, not like our other domestic animal. You see, that is a very small uterus. You will get the uterus only by giving incision in the pelvic brim, near the pelvic brim, not in the abdominal cavity, because it is like almost like human. That is why it should be come to the pelvic area, and you will be able to successfully do this operation. And almost after 30-40 minutes, animal will come back. And if you need more anesthesia for prolonged duration, then you have to give a second injection if needed. But a good hand, skilled hand, can complete it within that particular period. Another, the species monkey from this langur, Cape langur, that was also getting a injury in the tibia and fibula, which was treated by giving ketamine at the rate of 10 milligram per kg body weight. That means for the, I have told already that for the primate, if 10 milligram per kg ketamine acts as a sole anesthetic. See, loop gibbon, that is an endangered species. Only in some species of India, and one of the important sites for that is Assam. It is always remaining on the tree. It is never coming down. So when it is coming, when you have to capture it, you carefully, with the help of the ketamine and the ratio of the 10 milligram per kg, you have to tranquilize it, and by holding a net at the bottom, that will lie down from the treetop to the net, and you, after capturing, you have to examine it, and our workers are examining hard, and when he is getting okay, then that will be put in a case, and that will be translocated to their desired destination. So this particular animal is called human primate. That is not non-human primate, it is human primate, that is having 95% genetical similarity with the human. See, that is a brown bear in our Guwahati zoo, which has suffered for a paranasal tumor, getting difficulty in respiration. Very deep snoring sound is coming because of the difficulty in respiration. As per request of the zoo authority, we have anesthetized the animal by using meditomidine 50 microgram and adding ketamine with that. And then the paranasal tumors was removed by surgically, and following recovery of these things, the bear was able to take respiration properly. Next, you see a hyena in the zoo. It was suffering from an injury in the oral cavity where there is a broken tooth. So the hyena is just like a canine. It is a canine species where, just like a Alsatian dog, you can tame it by giving xylazine 1 milligram per kg and ketamine 1 milligram. So that will give a good anesthesia even more than an hour, and you can perform the required operation. In our case also, we have removed the broken tooth, and we have lacerated lips, we have repaired, and after that we put it in the cage, and then gradually it recovered automatically inside cage. Now see, this, so another sole anesthetic ketamine can be used for the peacock. That is a peacock of temple. It is a sentiment of the rural people. A group of people has come to my department for treatment of this peacock, where the peacock was suffering from a big tumor in the wing. Because of the tumor, the peacock was not able to fly, and they have prayed God and requested me for operation. So surgically, by giving ketamine anesthesia, we have removed the peacock and dressed it, sutured it, and after few days, when he left, the peacock has started again flying like normal. Then the people were very happy, and we were also very happy to know about this. Now another dimension I am going to speak about, the very uncommon animal like river otter. Very uncommon, where it is radio telemetry is performed to know about this movement of this animal. It is a good study. American people have introduced these things, and it has come to the wildlife now. And otter is a very small animal, hardly weight 5 to 7 kg, where ketamine is given 10 milligram per kg body weight. See here, it is a otter, and this otter, we are fitting this radio telemetry machine. It is a transparent machine having a circuit inside that was placed inside the abdomen of this otter by making it through laparotomy incision under ketamine anesthesia. So after that, it was sutured and completed, and the animal was kept inside the cage for 15 days until healing. When complete healing was there, this river water was released in the water body, so that the water it can swim or it can go as per its own interest. But by sitting inside the laboratory from the connected computer, you can assess whether it is taking its food, whether it is alive or it is killed by the postures. So nowadays, this radio telemetry seats insertion is becoming a very popular method in case of the animal which are generally staying in the river. It can be even used in the turtle. Also, it is used in the river water. Anaesthesia for pygmy hog. Probably you are knowing that is a very small wild animal weighing hardly 5 to 10 kg range. It is an endangered species declared by the government of India. That is jointly government of India and Darrell Wildlife of UK has started a program in Guwahati just to propagate its number in the wild. So in that center they have started with, and where some minor operations have to be carried out, they are using azapiron at the rate of 4 to 8 milligram per kg body weight, along with ketamine 10 milligram per kg weight. Anesthesia for elephant pediatrics. Commonly, these problems is coming. You see that is one day-old elephant calf has suffered, and now the suffered means the trunk was severed. It was injured severely. It is going to be detached almost. It is a day-old calf. But how you will anesthetize? Two of my colleague veterinarian. Even my students, they were my students, but now they are veterinarian. They accompanied me. When I asked them, they have told, sir, use metitomin or xylazine. But if I am using such anesthetic, then certainly there will be a death, because that is a neonatal animal, just day old. You see how small the calf is, hardly 30 to 40 kg weight will be there, and it is with the mother. Then it is inside the jungle. It is Nameri National Park, a famous national park of Assam. So I, along with the forest personnel and 2 of my field veterinarians, went there, and then I have told you that you have to select an anesthesia which is good for pediatric. So I have used ketamine 5 milligram per kg body weight intravenously. Within 2 minutes, the calf has lied down. We have taken into a bed there, and probably you have seen how my colleagues are helping me to perform this, because this area is mutilated by this and by the calf itself, and we refresh it and then we suture it. And after that, we applied some medicaments which can heal it properly, particularly the collagen paste. So that has healed after few days. So that is why knowing about the neonatal and pediatric anesthesia is very important. Our veterinarians should know, because without knowing these things, if you are using the substance like xylazine and metitomin, which I am telling repeatedly as a good, but in case of neonatal, they will get a bad result. So they have to remember it. Then I am going to say about the reversal. You see, adrenoceptor agonist, you will get numbers of reversal, but the etipamazole is occupying the top because it is the specific alpha-2 adrenoceptor antagonist. So any alpha-2 agonist can be reversed within minute to few minutes. In elephant, if you use this in a heavy sedation, the elephant will reverse within 2 minutes. A tiger will reverse within 7 minutes. A rhino will reverse within 7 to 10 minutes. Like that, with a nice performance of this, you can reverse and you can ascertain a successful surgery. Beyond that, etipamazole may not be always with you. Beyond that, there are alternatives: yohimbine alone and with 4-aminopyridine. Tolazoline is another, and idazoxan is another. Tolazoline and idazoxans are still difficult to get. It is from abroad. Then narcotic antagonists, already I have shown you the diphenophyne. It is specifically used for diethorphine. But I have told that do not go for practicing diethorphine, because it is a dreaded anesthesia for the handler as well as for the animal. Profound respiratory depression and death within few minutes. That is why anesthetic world is now cornering these anesthetics and bringing this alpha-2 adrenoceptor to the mainstream. Then benzodiazepine antagonists can be used flumazenil. See here, the rhino, which we have radio-collared in a national park named Manas, a famous national park of Assam. So after radio-collaring, we are reversing with the etipamazole. I am injecting, probably you have seen, I am injecting this anesthesia into the air vein, and within 7 minutes the animal will stand up. So just after injection, we have to go away immediately so that it cannot reach you to attack. And if it is inside the deep jungle, you have to get into the elephant's back. Otherwise, the same animal may attack you. So we are doing reversal like that. We are getting 100% success till today because we have handled many of the animals doing different surgery, radio collaring, air tagging, blood collection, and bullet injury like that, and we are always successful. See, I am going to say how you will reverse. There is a point. Generally, two types of reversal is done when we are doing with the equal dose of etipamazole. That means, suppose for rhino, I have told that 20 microgram per kg body weight meditomidine is used for sedation. If you reverse it with the 20 microgram, same taking the etipamazole, it is called equal dose. But after that reversal, the animal will be reversed. But if you observe the animal within 15 to 20 minutes, the animal will again resedated. Then the animal will come to take shelter of a tree, where it is dispersing its weight to the tree either by the head or by the whole bodies. And that is called rebound effect. And generally, sometimes to observe some things, we produce rebound effect because we have to monitor the animal. If you do not think that we should not monitor the animal, then we are injecting double the amount of this meditomidine. The etipamazole, that means double the amount we are injecting, where it is completely reversed, it is totally alert. But in that case, it is severe. You have to immediately go away. Otherwise, the same animal may attack you. That is why be careful and know it to use etipamazole, and you will feel happy when the animal after surgery it is going back in a normal way to the jungle. Then drug delivery system used among this, the rifle is commonly used because it can be covered up to 200 meters distance. So most commonly in our cases, we are darting it from the elephant back by going into the jungle, and we are using the metal dart for the thick skin like rhino and elephant, and the plastic dart for the soft skin like tiger and other animals. The side commonly preferred is the neck muscle. When you are approaching the animal from the front side, it is neck muscle, and from the back side, if you are approaching, it is gluteal muscle, because these are very muscular area where the dart can pierce, and your successful result is more. Time of darting, generally we are selecting morning hours when it is pre-planned. But in emergency, you can go at any time. It may be night hours even in the searchlight. See this side, how this metal dart is piercing the neck of the rhino, and another it is piercing the gluteal muscles. So in that case, the drug is certainly going into the muscles, and it will show good result. The animal will be sedated immediately, and you will be able to carry out your operation. Instead of that, if it is going to other places, then your drug will not be pushed totally, and you will not be able to approach the animal, and your work will be half-hearted. Now, monitoring of the immobilized animal, how a anesthetized animal will be observed by an anesthetist. That should be always keep in eye with the depth of sedation, because in some cases, you cannot assess the animal. You have observed the animal almost 200 and 300 meters away, which you have darted. You do not know the individual variation of the animal, how the heart is there, how the lung is. So individual variation sometimes causing severe depression, heavy sedation of the animal. In such cases, you have to see the level of the level and depth of the sedation. If it is going to the extreme depth, then you have to reverse. Or if you can manage, then you have to give life-saving drug. Moreover, when you are going just closer to the animal, when you are touching the animal, you have to see the mucous membrane. And immediately in approachable animal, you touch with a pulse oximeter and fix it with the animal body. You can see the oxygen saturation and see the temperature so that it is remaining below 41 degrees centigrade. If it is touching 41 degrees centigrade, immediately oxygen support is required, otherwise immediate death of the animal will be there. See, that is a rhino calf we have sedated, and we have touched with a pulse oximeter, and the pulse oximeter is showing 93 degree, 93% oxygen saturation. So if it is 90 and above, then it is good. Sometimes it may come lowest to the 83, but if it is up to 83, it is tolerable. If it is lower than 83, you have to give immediately oxygen support or reversal. So in our case, we are getting 93. So it is good. We have carried out the operation excellent way. And this is another rhino calf under Mediterranean ketamine in a rescue center in Kaziranga. If you are visiting sometimes Kaziranga, you will be see our work there in how our veterinarians and we are working there. So we have performed a limb surgery and following that it is given for recovery. See there, that is another for air tagging. We are performing this anesthesia with the ditomidine, azaperon and butorphanol. And we have immediately connected with this pulse oximeter. The machine is connected to the tongue of the animal and it is showing 90% saturation. And we are happy and the animal was sedation was carried out successfully. But how will carry out the care of the immobilized? When you have darted, the animal will lie down immediately. Sometimes very forcefully it is coming, sometimes very slowly it is coming. You cannot predict these things. So when the animal is coming down in a jungle, you will be guarded by some other wild elephant from the surroundings so that other wild animal cannot attack you. Then you and your assistant will come down from the elephant back to the ground and you have to run to the animal and first straighten the neck of this animal. Because many a time bending neck may kill the animal. So in case of elephant, always is remember, if you are darting an elephant, your darting it should be always in lateral recumbency. The animal, if it is coming to the sternum, then it will suffer from pressure in the diaphragm and death, the possibility of the death. But on contrary to that, if you are doing in a rhino, you see, I am showing in the red letters that it should be always in the sternal recumbency. Instead of that, if it is coming to the lateral recumbency, then it will be hypoxemia and death. So this is in tiger and rhino, this is the contrast. In deep, in deer, buffalo, it should be always sternal recumbency. Otherwise, there will be aspiration and death of the animal. So always you remember these things. See there, we are going for giving radio collar and in the air tagging in the tip of the air. And in that case, these both of the rhino are in sternal recumbency. So that is safe. If you are keeping this rhino in this position for hours or more, no problem. You can carry out your required operation, and then you can reverse as per your requirement. It is totally safe. But in case of elephant, you see, the elephant should be always in lateral recumbency. Here, never follow the right one, the sternal. It is dangerous. It will suffer from hypoxemia and death. So lateral recumbency is suggested. Another elephant tusker, you see, we have performed operation by under romifidine anesthesia by giving 20 microgram per kg body weight, where this was carried out under work of one of my students who has carried out his thesis work under romifidine, who is working now as a veterinarian in the Dubai Zoo. So he has carried out a big operation at the back of the elephant. You will be surprised to see. I will show you this photograph later on. Surprised to see how big operations was performed. This is a buffalo, the most dangerous inside Kaziranga. We consider it more dangerous than the rhino and other animals. And with romifidine 20 microgram per kg, it is lying down. But going to the lateral recumbency is not suggested because there is aspiration and blocking of the trachea and death. That is why immediately after coming to the lateral recumbency, you have to put it in the cage and reverse it. Then only the animal will save. This animal was shifted from Kaziranga to another national park about 400 kilometers away from Kaziranga. Now, regarding the selection of drugs, how you will develop your skill, how to select this anesthetic which I have told. Regarding that species is the first thing. I am telling that if you are going to do for rhino, suppose meditomidine or ditomidine and azaperon and butorphanol, there is no other alternate. And if you are going to carry out in a primate or in a feline species like tiger, you can carry out with the ketamine or by adding the ketamine xylazine like that. And likewise, if it is for a bird, only ketamine is the sole anesthesia. See, you should assess the duration of the anesthesia because the surgeon will take a certain time. You should know how much time will be required for the surgery. Accordingly, you have to carry out the anesthesia. So, when you do not know in the wild whether the female animal is pregnant or not, because you cannot go for ultrasound before that anesthesia. So that is why you should take always a safe hand in your hand. If you use meditomidine, that is a pregnant animal, it is safe. It is proved by many of the workers, including the Professor Zalanka from the Helsinki Zoo. He has proved and he has written in his book of wildlife anesthesia that meditomidine is safe. And even we have proved many a time in our state by injecting this into the pregnant animal, which we can carry it out safely without affecting the fetus. So it is one of the good things for the veterinarian, that as we do not know in the wild whether it is pregnant or not, and as it is a refined anesthetic and very powerful anesthetic, we can select meditomidine for. And our concern, like Assam, is a terrain. You know, in case in our jungles are with dense forest, mostly with the hill and water bodies. Sometimes suppose the elephant is standing in a just nearby a water body. If I am doing some opioid group like etorphine, then immediately lie down, and that it may fall down into the water body, it will drown and sink in the water and it will die. So that is why we are using the anesthesia like meditomidine when there will be standing sedation. And in standing sedation, with the help of the other domestic elephant, we are giving seine to the animal, we are pulling it to a safety area, and your animal will be safe. That is why the hilly terrain, water body, or in the dense forest, it is always suggested standing sedation. Moreover, the excitement of the animal should be always considered, because alpha-2 adrenoceptor agonist in excited animal will not work, because you know the pharmacology of this drug. Because once the animal is irritated, then there will be release of epinephrine, and if there is sympathetic stimulation, ultimately it will not work because it is an alpha-2 agonist. So in that case, you should better avoid alpha-2 agonist. You should go for another group of drugs which can do a nice job for that, so that you can successfully carry out your operations. See, remove in standing sedation, we have removed bullet from this base of the ear of a elephant calf in Kaziranga. That was injured by some posters. Now see, the standing anesthesia under meditomidine, you will be better understand this by looking to this animal, how the elephant is widening its leg. Also the trunk is totally relaxed, air is drooping towards front side, and there is deep snoring sound which is audible from 200 to 300 meters. In that case, if you cut the elephant into two pieces, if you cut the trunk, you will not know what is happening to the body. So nice analgesia, so nice elephant, these muscle relaxations, you can carry out any operation under this. See, under romifidine anesthesia, we have operated big. See how in the back of the elephant, how we have operated about almost more than 2 feet long, a big operation. And after that, from this pocket, we have removed approximately 10 liters of pus. And that is the black color, that is the gauze soaked in betadine. We are keeping it, we are just cleaning this pus with the help of betadine soaked gauze. But you need not worry, it may be very big, but it will heal by 45 days, because healing power of the elephant is very high. So you need not worry for that. If you dress it regularly, then even without antibiotic, proper dressing will help you to healing, and you will be happy to see a good elephant condition. So that is in the sedation, in standing sedation, you can carry out this type of work. Now see another very pathetic condition where this calf has fallen down from a hilltop, and where the mother has died immediately because of injury, and we have rescued this calf with multiple injury, and we have sedated with Delazine only with 20 milligram. 20 to 50 milligram is the range for that for calf of up to 1 year, and then we have dressed it. After continuous effort to treat the animal for 3 months, the elephant calf survived, and then it has gone to the jungle again. See, that is a rhino calf by 20 microgram per kg body weight. We have created standing anesthesia. From the standing anesthesia, you can create walk-in anesthesia. Suppose you want to take one rhino from one area to just nearby few meters or 100 meters away. Then by creating standing anesthesia in lower doses, if you pull it by giving seine or ropes, then it will walk. That is called walking anesthesia. So you can carry out. Now I am going to say about some of the very uncommon animals where I have treated the river turtle with xylazine and ketamine, xylazine 0.5 milligram per kg and ketamine 3 milligram per kg. That was a 30 kg weight turtle. You see, it was confiscated by the police from about 300 kilometers away from Guwahati and sent with along with a veterinarian to the college. See that the meat of the turtle is very costly, more than 1,000 rupees per kg. So the people are going for pushing and killing it with the help of fishing. So the fishing hook is retaining in their mouth. So it is very difficult to remove it without anesthesia. When you are giving anesthesia, the head of the animal, which is generally hiding inside the cell, that means carapace or pastule, it is relaxed and it is coming out. Once it is coming out completely, I have opened it with the help of a forceps and see that is a fishing hook piercing the soft palate. And we have removed this, and this is the removed fishing hook. After that, we have treated this elephant. We have even given saline. I have demonstrated to my student how the Rinjas lactate can be given to a turtle and how we are giving antibiotic. Then again, it was sent back to release in the same river. So pangolin, you see, another very uncommon anesthesia. Uncommon animal. It is mammal but looks like reptile because the whole body is covered with scales. See how it is look like. Probably many of you have not seen in reality about this pangolin. So in our state and also our adjoining state of Meghalaya, these animals are there. This animal was sent to my college in my name, writing by the Forest Authority to treat about a broken leg. Here probably you have seen in the photograph that in the leg it is getting injury and one of the nail was removed. Here the nail is just like a knife because it used the nail to burrow, to make a burrow in the earth, just because it is staying in the burrow. Also it is breaking the earth to get the white ants, which is its main food. So for inserts of the food, when it is going, sometimes probably it has got injured in the neighboring state, my neighboring state Meghalaya. When it is come, then I have sedated with 10 milligram ketamine per kg, and then I remove the exposed bone here, and then rest this leg and send back into their own state. And after a few days, their veterinarians, after recovering from this problem, it was released in the jungle. See, very uncommon and very endangered species which is covered by the ISVS India red list. That is slow loris. And that slow loris, one of the slow loris here was recovered. That slow loris has suffered from corneal injury. So you know, all of you know how problematic to treat a corneal injury in domestic animal. Now think about the slow loris, which is a very difficult animal to handle. So we restrain the animal by giving the ketamine anesthesia, 10 milligram per kg body weight. Then we have injected antibiotics subconjunctivally. Then we use tarsorrhaphy. After tarsorrhaphy, we maintain it inside the cage and for 7 days. Then we remove the tarsorrhaphy. After healing, again prednisolone was injected to the subconjunctival area. When it got the total transparency of the cornea, then it was released in the jungle. So by this way, different substances can be used, different anesthetics can be used for our use. So what is the ultimate goal of the wildlife treatment? The excellent anesthesia can only help the surgeon for surgery, because anesthesia is the gateway of wildlife surgery. So that is why we can make the wildlife healthy by proper treatment, that is with the help of excellent anesthesia, and we can save the animal from extinction, then we can maintain the ecological balance, and then we will get a good health for all. Now for your encouragement, when you see the elephant, that is of course not in my lecture, I am showing you the white elephant of Thailand. So thank you very much for giving me time to deliver this webinar before you. You can ask me any question if.
Thank you very much, sir. It was an excellent presentation, sir. There are a lot of compliments for the your webinar. We have a few questions. The first question is: we always use ketamine with diazepam in pediatric and compromised animal. Is it better to use ketamine alone in wild animals?
Yes, yes. If you go to the recent anesthetic book written by the Grimm, Tranquilli and Raymond from USA, then you will find then ketamine can be used as a sole anesthetic in some of the species. And in practically we have carried out, I have shown you also in bird, in primate, in the neonate animal like this calf, which I have shown you. But instead of that, if you use diazepam, you know that diazepam is metabolized to three different things: oxazepam, nordiazepam, or like that, three different metabolites. So that cannot be metabolized because hepatic microsomal enzyme system is not developed in the neonate, because that is a day-old calf. So the ketamine can be excreted even without breakdown. That is why it is a good anesthesia for some of the species, but not for all. Yes.
Okay, sir. Thank you very much. Sir, the next question is, can you please highlight regarding the authorization of using dart gun for anesthetizing wild animals?
You see, that is actually a property of wildlife for the Department of Forest. So it is generally kept with the zoo and the wildlife premises. But if needed, the surgery department or the wildlife department in the veterinary college can keep it. Many of the colleges like Madras Veterinary College, then Thrissur Veterinary College, in their wildlife department, they are keeping this darting equipment. So it can be kept in all of the colleges, but it needs a written permission from this wildlife authority.
Thank you, sir. Sir, the next question is regarding maintenance of anesthesia in wild cats for longer duration. What do you use?
See, actually, if you use combination of ketamine and meditomidine for wild cats, at the rate of 50 microgram per kg body weight meditomidine and ketamine 10 milligram 2 milligram per kg body weight, it will give anesthesia for more than 2 hours. And I have shown you one of the operation hysterectomy in Tripura, my neighboring state, where I have removed this uterus and ovary. It takes only 1 hour 23 minutes. So 2 hours is very long. So then why you can finish it? But if you feel that your that anesthesia is not sufficient, you need more anesthesia, then you add additionally ketamine. So that will give. You can go on adding for 2 times 3 times more. Likewise, you can go up to 3 hours, 4 hours duration. There is no harm of adding ketamine. Up to 4 hours, if you are going, there is no harm. So animal will be in the safe hand.
Thank you, sir. So the next question is, can you please tell regarding how to measure body weight in elephants, rhino, and deer for anesthesia?
See, there is some assumption formula given by some earlier wildlife workers. If the elephant is weighing above 8 feet, 8 to 10 feet, it is in the range of 4,000 to 5,000 kg body weight. Generally, the adult and good growing elephants are in the weight of 4,000 to 5,000 kg. And below 8 feet, it is considered 3,000 kg or less than that. So accordingly, you have to compute the dose. And tiger, a full-grown tiger, when you observe, then it is 120 to 140 kg body weight. So accordingly, you have to take your drug. And the meditomidine, that is why I am telling it is so safety and refined anesthetic. If your dose is somewhere going to double by mistake, it will not kill the animal. It will lengthen the period of anesthesia. That is why it is called dose-dependent anesthesia. That is the gift for the veterinarian. I am telling at the beginning, at the introduction, that following discovery of this drug by the Finland, it is really a gift for the veterinarian. By giving even the double dose, there will not be any casualty. Rather it will lengthen the period of anesthesia. I think you are clear.
Thank you, sir. Yes, sir. Thank you, sir. Sir, the last question is safe sedation protocol for transportation of wild deers.
Wild deers.
Yes, sir.
You see, we have translocated deer several numbers, probably one time 20, one time 30 like that. From Kaziranga National Park to Manas, approximately 450 kilometers. Where along with us, one of the experts from the African jungle, Dr. Marcos, has accompanied. There, after sedation, when we are putting it in a trap, fully covered trap, keeping the trap dark, and we are using azaperon 50 milligram, 40 milligram, because 1 ml azaperon is maintaining 40 milligram. You know that the brand name of the azaperon is stress nil because it mitigates the stress. So during transport, the animal will not be any stress. So in a good condition, you can carry it. Secondly, you can add moreover the stress mitigating factor, you can inject dexamethasone. But azaperon is alone is sufficient. So we are not taking risks. We are giving azaperon as well as we are giving injection of dexamethasone. And all the animals are without stress, healthy. We have released there, and when released, they are going jumping away from this trap, and all are propagating now with their new generations in the jungle. It was a great success. I have told at the beginning where the Kashmir, Bhopal, and Bengal have failed to translocate. At the initial stage, they during their anesthetic trial, the animal has died, and we have proved our successful work, and then we carried out it, and now our model can be taken by other states for translocation of the deer.
Okay, sir. Thank you. Sir, we have one more question. What is the dose of ketamine and xylazine for chinkara and black buck?
We are not generally experienced with chinkara and black buck because it is not available. So better not to use xylazine, because xylazine, if you are using double or triple dose, it cannot sedate it. I am referring you one book for wildlife anesthesia, which is written by Professor Zalanka of Helsinki Veterinary College, Finland. And if you need, then I will send through this email or by this WhatsApp the particular dose range of the different species. They are suggesting generally 60 to 100 microgram per kg body weight. So actual drug is meditomidine. So now in addition to that, when you are giving ketamine, you can add ketamine 2 milligram per kg, 3 milligram per kg, that does not matter. The ketamine is simply potentiating this and helping this meditomidine. Main drug is the meditomidine. Probably you are clear with my point?
Yes, sir. Sir, one more question is, how can we procure yohimbine, meditomidine, and tipamazole? Please, sir, if you can guide us.
You see, meditomidine and all alpha-2 adrenoceptor agonists are except romifidine. It is produced and marketed by the Orion Corporation of Finland. You have to get contact with them. Then you write to the government that you need either for the research or for your fieldwork. If you are writing that you need for the research, then the government will give permission, then you can get it.
Yes, sir.
And
thank you very much, sir.
So probably you see now one drug, Zolatil, is available. You can use in the feline species nicely in your lion in Gujarat and in tiger.
Yes,
so I have requested this Virvek. You by paying 1500 rupees per vial, you can purchase it and you can use for, and for other species also. For cat, for lion, even for the smaller species which I have shown you, for jackal, hyena, you can use all this, and that is available by this Virvek.
Yes, sir. Thank you, sir. Okay. Sir, one more. I have one more question for you. That is best anesthesia for star turtle, sir.
Star turtle?
Yeah. Yes, sir.
See, we are not getting much turtle. Very less we have operated. Just for all cases are for removing the fishing hook. As I have shown you, that is a common problem. It is coming with the piercing fishing hook in the mouth. So we are using this xylazine and ketamine, as I have shown, the xylazine 0.5 milligram per kg and ketamine 3 milligram per kg. You inject in the thigh muscle, in the posterior leg. Then within 5 to 10 minutes, it will get relaxation. The head will come out from the cell. Because it is generally covered by the carapace and pustule, it will come out. When the head is coming out, then you can do anything. Even you see, I am giving you another thing. Probably you may not get this chance, but if you are getting, you see, in the foreleg, just like a dog, if you press the forelegs, then you will find the radial vein. The radial vein is larger than a dog. You can infuse Ringer's lecture into this vein intravenously. Suppose in that case I have shown 30 kg body weight, so I have given sufficient fluid for that. So in your case, if you are getting it, and I come to know that in Bombay, they are in some of the turtle clinics are there. In Netherlands, I got that some turtle clinics are there. Developing country, probably only in India, probably only in the Bombay, the turtle clinic. So you may contact with them also, and xylazine and ketamine is enough to relax a turtle.
Thank you, sir. So that's it for the question answer session. First of all, on behalf of entire organizing team, ISVS and Intas, I would like to thank our today's speaker, Dr. Bhupen Sarma, sir, for sharing his valuable field experience, which will serve as a comprehensive reference for the growing fields of zoo, wildlife, and exotic animal veterinary medicine. Sir, you made an excellent attempt to present a comprehensive, ready reckoner for veterinarians on wildlife capture and very practical information with a systematic documentation of immobilizing drug, their usage and its availability, along with information on variety of anesthetic equipments, its usage, darting techniques, and precautions while capturing the wildlife. Sir, I know that the discussion was based on very extensive experience spanning over more than 2 decades in handling and care of anesthetized wild animals, which has optimized for achieving safer, efficient, and reliable anesthesia. The information shared by you will be exclusively important during handling of valuable endangered animals, as many times anesthetic recovery would be dangerous and may prove fatal. Sir, I believe that this webinar would be useful for zoo and wildlife veterinarians in India for safe use of chemical capture methods in case of precious wildlife species for the clinical health management, experimentation, and translocation, etc. Further, I would also like to thank the President of the Society, Dr. Simrat Sagar Singh, sir, and the Executive Secretary, Dr. Deepak Patil, sir, for their guidance and wholehearted support. I would also like to thank our organizing team and knowledge partner, Intas Animal Health, for their support. Thank you, Dr. Deepak Tiwari, Dr. Neelesh Sindhu, Dr. Nitin Bhatia, and Dr. Amanjot. Thank you very much, everyone, for being with us. Thanks a lot.
Thank you. Thank you all. Thank you, ISVS team. I am really grateful to you for giving me the opportunity to present the webinar before you.
Thank you, sir. Thank you, everyone.
Thank you.